Shall we start? Are you getting my voice?
Yes, sir.
Someone have added whiteboard again. There is some problem. If there is anything, again the hacking process might happen, then we'll discontinue with this meeting. Because all of a sudden there was a whiteboard. Okay. And my suggestion to all of you are that you should write your whole name so that it will be quite easy for you to admit inside the meeting. Okay, good evening, everybody. So, meeting again in the session of Materia Medica, and we're going to learn very important remedy which have saved many patients in my practice, especially the old persons, where there was a senile dementia, where there was a progressive supranuclear palsy, and degeneration of the brain, the cerebral sclerosis. So this is a wonderful remedy, that is the picric acid, which we're going to learn in today's session. It's short remedy, but has a very strong action on the brain, spinal cords. And that's why we have to learn its all aspects. So dear friends, first I will share one case. It was case of my one of the relative who was nearly about bedridden, who has lost total memory, who was admitted in Pune hospital. It was way back, and he was discharged, diagnosing by progressive supranuclear palsy. PSP was the diagnosis, and they said that there is no chance of recovery. There is no medicine, in fact, for him, and he was not recognizing anyone. He was just lying in bed as if dead. So nothing was working for him, and they said that you just keep him as it is, nothing will be done, and then they left the treatment, and then he was brought to home. There was a call from them to me. Uh, they used to call me, Dada, is it possible to treat this, or is there any treatment available in homeopathy for such a patient? And when I saw him on video call, I was just shocked. He was there on bed, and they said that if he has been kept in this position, he will be kept, he will remain in that position. He will not change even, he will not going to turn, nothing. The RT was there, put, and the food was going on through RT. There is catheter was applied to him. And second important thing, that he passes involuntary stools once in a or twice in a week, and nothing, absolutely zero response was there, and he was just lying over there in that position, and he was not in comatose position, but he was awake, but he was not knowing what is going around him. He was not recognizing his wife also. He was not recognizing his children. He was not recognizing his daughter. No one. And he was lying in bed in same position, and it was complete cerebral sclerosis. They said that it is no, there is absolutely brain damage. One cannot do anything in such types of cases, and there is absolutely senile memory loss. So I saw him. He was the previously he was the businessman, and he was a very good businessman. But in last before I was examining him, before that 5 years, he was having some financial loss. Thereafter, gradually he disturbed, and gradually he started. Yeah, the degenerative process has started in him, and gradually it developed, and he reached to such a level. He was on allopathic medicine for hypertension. He was for allopathic medicine for acid peptic disease. He was there on allopathic medicine for his diabetes. All those things were there. And they diagnosed this is the first they diagnosed it is just senile dementia, but that the MRI was done and everything was done, and then they explained that it is progressive supranuclear palsy. So absolutely weakened. There is no strength which was remaining over there, as if lost totally vital force over there. Just a slight amount of vitality was remaining over there. So I saw him and I saw him that he was completely disoriented, not having any sense or etc. So such a debility, such a disorientation, such a loss of memory, such an indifference, such a complete loss of strength, prostration. First thought come to my mind when their problem is related with cerebrum was the picric acid. So I asked them directly that you bring the picric acid and 30 and give it to him for continuously for 3-4 days, 3 times a day. After starting the picric acid 30, within span of 10 days, he was started getting the movements of the extremity. He started looking up. He started that remove this, that right tube. And then some general practitioner who came and who has removed the right tube and he started eating. Then this fellow was looking towards the wife and showing some reactions. Then he started removing the catheter with his hand. So catheter was removed and he was able to pass the urine. I have continued him with the same potency, again repeated few more doses because he was improving and sometimes it was just action was decreased. So I have repeated it. Again after 10-15 days, there was a great change in him. He started recognizing the peoples. He started looking to them. He tries to speak, but there was no strength. But he started eating, and gradually he got that strength. He started recognizing everyone. Then I have increased the potency to 200. And after 200, there was a sudden change. The improvement was so fast. Then he was able to sit. Then he was able to move inside the house with the help of with the support of the peoples. And this continued. I have changed potency right from 30 to picric acid CM in his case. He was thereafter alive for 12 years. And only thing which was not happening, he was afraid of going outside the house. Otherwise, everything was normal. There was no involuntary stools, no involuntary urination. Everything he used to do, he used to read thereafter the newspapers and watching the TVs and everything. Everything was fine. 12 years. And he died 12 years after that with the natural death. It's so wonderful remedy in old age senile conditions where there is cerebral weakness is there, cerebral damage is there, sclerosis is there. Sometimes even spinal cord sclerosis is there, spinal cord weakness is there, or which is also called as a spinal cord softening is there. This is a wonderful remedy to be utilized in such types of cases. Even in acute ascending paralysis, in acute states, picric acid is one of the important remedy if it happens in old age. So this remedy has a very wide approach, specifically in brain and spinal canal conditions and the senile dementia. Let us open the Kalinske notes. So we're going to learn this remedy from both the books, Kalinske notes as well as Boericke's Materia Medica. Only few aspects of Boericke Materia Medica, which is not there, covered under the Allen's that we're going to learn. So picric acid from Kalinske notes is often restorative of wasted and worn out system. First sentence, wasted, wasting is there, tremendous, and worn out, exhausted completely. A fair picture of nervous prostration. It is the prostration of nerves, exhaustion of nerves, like caliphosphoricum, very close to caliphos in such aspects. Caliphos is also a very important remedy for nervous prostration. Progressive pernicious anemia. This is, see, This happens in vitamin B12 deficiency, progressive pernicious anemia. And people goes on taking the vitamin B12, B12 is less, they give the vitamin B12 and many times patient improves. But sometimes vitamin B12 is good and still the patient is having such a thing. And nerve weakness is there. Picric acid covers that specific weakness. Picric acid, the remedy from the destructive miasm. Neurasthenia, exhaustion of the nerves. There is brain fag. It is wonderful remedy close to the caliphos as well as argentum nitricum with this. Brain fag, especially of literary or business people. So brain fag of literary people, brain fag of business people. Slightest excitement, mental exertion or overwork brings on headache. Headache is characteristic and it is because of slightest exertion, excitement, mental exertion, the overwork, and causes burning along the whole spine like caliphus Boericke. So burning is the characteristic over here specifically of the spine, very important feature of picric acid. Headache, headache of students, headache of teachers, headache of overworked businessmen, headache from grief or depressing emotions, headache especially in occipito-cervical region. This is the area where it is marked. The remedies are, we know that silicia is very marked remedy, but there is semicifuga, the gelsemium. These are the remedies which are having very typical posterior occipital or occipito-cervical headache. Natrenmure, aggravated or brought on by slightest motion or mental exertion. So mental exertion always aggravates the complaints of the this picric acid. It is very they gets exhausted whenever they tries to you work over the brain. Then priapism. Priapism, anyone knows what is priapism? Priapism is the long, prolonged, continued, rigid penis erections without stimulation. It is because of spinal problem. It is because of spinal nerve problem. And this is continuous, which is very painful also. So priapism with spinal disease, the erections violent, long lasting, profuse seminal emissions, satyriasis. Satyriasis is nothing but uncontrolled sexual desire, specifically in males. It happens to be there. It is called as satyriasis. The remedies mentioned over there are cantharis. Then remedy is mentioned over there is phosphorus. Already we have discussed on that day. Small boils in any part of the body, but not specially in external auditory canal. So leaving behind the external auditory canal, anywhere you can get this, specifically the small boils, tendency to the boils, burning along spine and great weakness of spine and back, softening of the cord. So this is a wonderful remedy in myelomalacia. Myelomalacia is nothing but spinal cord which becomes softened. Specifically, it happens generally due to the acute injury to the spine, where there is a lack of blood supply to the spinal cord, and it produces the weakness and softening of the spinal cord called as myelomalacia. The phosphorus is one remedy. Already we have discussed regarding it. Phosphorus sclerosis is more marked. Ginkgo is one more remedy where it is there. Weariness. Weariness means exhaustion. So much exhaustion that patient cannot do anything. Progressing from slight feeling of fatigue on motion to complete paralysis. So it starts gradually. First, there is a fatigue. The patient tries to avoid going anywhere, and then gradually progressive muscular paralysis, which develops over there in this remedy. Tired, heavy feeling all over the body, especially of the limbs, aggravated on exertion. So heaviness is characteristic. Then the fatigue is characteristic. Exhaustion, prostration is characteristic, followed by a paralysis. Relationship, he says, compare argentum nitricum having very similar presentation of the brain pack, the nerve remedy. Gelsemium, yes, gelsemium is also having the occipital headache. The nerve remedy is paralysis. Califos, very close to the picric acid. Phosphoric acid and phosphorus. These are two remedies. Phosphoric acid for the debility which comes closer over here, and phosphorus specifically degenerative processes which are there in the phosphorus. Same are present even in picric acid. Petroleum, again petroleum and silicia, occipital headache, most common over there. Amelioration from cold air, cold water. This remedy is generally hot remedy. So generally they feels better in cold air. Aggravation from least mental exertion, that is the characteristic of this remedy. Aggravation from motion, aggravation from study, aggravation from wet weather. These are the characteristic of the remedy. So Alan has mentioned all those aspects, but at one level it has been not described. So my suggestion is that to open the Boericke's Materia Medica, the first paragraph will read, and out of which two to three things are there which we have to learn. Causes degeneration of spinal cord with paralysis, brain fag and sexual excitement, that already we know. Acts upon generative organs, probably through the lumbar centers of the spinal cord. Prostration, weakness, pain of back, pins and needle sensation in the extremity. This pin and needle sensation is very characteristic of this remedy. Then neurasthenia, that is the exhaustion of the nerves like oxalic acid. Muscular debility, heavy tired feeling. Myelitis, inflammation of muscles, muscular layers with spasms and prostrations. This is a wonderful remedy in writer's palsy. Writer's cramp, writer's palsy. Mostly we can think about the magnesium phosphoricum in writer's cramp. This is the remedy for writer's palsy. Progressive pernicious anemia, uremia with complete anuria. See, this is very important thing. Uremia with complete anuria, having a specific action on kidney, which is missed in Allen's notes. And this is one thing in senile patients, which you get very commonly in picric acid, and you can bring that patient out. Then Boericke has mentioned very specific use of picric acid. 1% solution applied on lint is best application for burns until the granulation begins to form. This is a practical utilization of the picric acid. I have tried it once when I was in the early on in my practice, when I was looking after the hospital. I have tried this, and it has wonderful effect over the burn process. The granulation happened very easily. Sallow complexion, the face is absolutely sallow, like yellowish brownish pigmentation over there. Then urinary complaints just open over there, will go over there directly. Urinary complaints, the scanty urine, complete anuria. Dribbling micturition, urine contains much indicans. So what is indicans? Potassium salt of indoxyl sulfate found in sweat and urine formed from indole. This is the indicans, and this you can get generally in CRF or ARF. You can get these things. Granular cylinders and fatty degeneration epithelium. Inflammation of kidneys and profound weakness, dark bloody scanty urine, nightly urging is there. So this is a very typical picture of CRF you can get over there in picric acid. Specifically, if it happens in old age, this is very important. And in extremities, last sentence is very important. Acute ascending paralysis. This is Guillain-Barré syndrome, acute attack of Guillain-Barré syndrome. It is nothing but a viral infection, considered to be a viral infection. Acute attack, must think about the picric acid in such types of cases. We know quinine is very good. Then we have Vipera, where you get the ascending paralysis. But this is one remedy one should not forget. In the modalities, one thing one should not forget, a summer or hot weather remedy. That sentence is very important. One should not forget. So this is a picric acid is a very important remedy in senile cases. So geriatric cases, one must always think about the picric acid, the how person reacts. So this is the remedy which we have learned has a multiple aspects The action is not mentioned over there, but this remedy is not an acute remedy. This remedy is always to be a chronic, having very typical effect over the nervous system and produces its pathology over there. Basically, cerebral degeneration and cerebrospinal degeneration. This is a very important remedy. So we have finished one more remedy from the third year syllabus, important from exam point of view and important in our day-to-day practice. So one should not miss this remedy in practice. So that's all for today. Now, my suggestion to all of you that you add your names clearly so that I can add you whenever I start the lecture. So that's all for today. Any query is there? We'll have a time we can discuss, otherwise we'll complete. So thank you being there. We'll meet again.
Hello, sir.
Yes.
Sir. Sir, one patient of mine, she is on नॅट्रम्यूर, म्हणजे क्रोनिक मेंटल्स वगैरे आहेत त्याच्यासाठी मी तिला नॅट्रम्यूर दिलंय. नॅट्रम्यूर वरती आहे ती. ऍक्च्युली हर एज इज 46 नाउ, and now she is suffering from perimenopausal symptoms or hot flushes and all. And 2 months she is having no periods. सो कॅन आय, आता ती सगळी मी तिची हिस्ट्री घेतली जेव्हा हॉट फ्लशेस अँड बर्निंग ऑफ सोल्स अँड पाम्स, तेव्हा सल्फर येते. कॅन आय शिफ्ट ऑन सल्फर?
If it is climacteric.
Yes, climacteric it is.
If it is climacteric.
Because she done sonography also. UHG, on UHG uterus is bulky on UHG. So
why to go to soric remedy? Why not? If you would have selected the natramur, why don't you think of sepia as a complementary to the natramur, and which covers the climacteric complaints again? It is a very important remedy for climacteric disorders.
Climacteric complaint.
So
then
if you complement it.
Yes, sir. How many days I should give this remedy?
After a gap of 1 month, you can give the sepia. After first prescription of natramur, if it has been acted and shown the result, then complement it with sepia. That will be better, because natramur is one part of sepia. Sepia is a very big remedy, animal remedy. So better to go with sepia instead of going towards the sulfur. Because hot flushes, sulfur, it is soric, that is burning feet syndrome. It is not climacteric over there.
Yes, sir. Thank you, sir.
Okay. So thank you and good night. We'll meet directly on Monday with next remedy.